I think working with patients and family members about quality of life is a really important thing, and it's one that nurses and advanced practice providers, as well as the oncologists, really do well when we get to know the patient and the family. What are the important things? For one individual, their priority may be their job. For another, it's making sure that their side effects are manageable so they can keep up with their kids' schedules and get to games and get to take them to different places or activities. So that circles back to the prior conversation about setting expectations. So that is a collaborative discussion with the patient and caregiver and the oncology team as to what is the goal of treatment. And oftentimes with the oral drugs, when we're thinking from the clinical side that we need to do a treatment interruption or decrease the dose because of side effects, one way to pose it is to say, can you do this? Can you tolerate this level of side effects for another 8 or 9 months? And then they may stop and think, I can push through it on a daily basis, but I'm not sure I can make it 8 or 9 months. And then that lends the conversation to go in one direction. Or they say, yeah, I can manage this, and that tells you we need to keep going and keep monitoring. Virginia, what would you like to share on that?
I echo your sentiments, Laura. I think what I try to focus on with patients is that in order to improve their quality of life on these combinations, it's important that we have early recognition of side effects or issues, prompt intervention, and then close follow-up. So when we hold something or we institute supportive management, we've got close follow-up to make sure that within a few days the person's feeling better. I know that seems sort of basic, but that really is important for patients. And your point about finding out what's important for the patient and family is such a great point, because what we may think is important for their quality of life could be completely different. So it's important to find out what they really feel would be the priority for them.
Virginia, you and Laura did such a great job talking about quality of life concerns. And when it's specific to a combination, I know, Virginia, you talked about it earlier, but trying to differentiate what side effect, what drug each side effect is coming from, and equipping your patients with at least some baseline knowledge of holding a pill for these specific symptoms or side effects, or reporting ongoing diarrhea or shortness of breath or rash, those types of symptoms, and reporting those to us early and equipping them with a few points if there's any change of baseline that they know how to contact us. I tell every patient in our practice, especially when I'm doing these new patient consults or these treatment review and coordination visits, that I don't ever want to hear that they're trying to suffer through something at home alone. That if they are ever concerned, I would much rather give them some reassurance on the phone than hear that they tried to tough through it for a few days. So I think it's overwhelming for patients to try to do things at home alone. So hearing that we want to hear from them and we please call us so that we can minimize your side effects comforts them, but it also helps with compliance and longevity on a treatment.